All right. And I'm SG. I'm a licensed naturopathic doctor here in Arizona. Um, I I wear a lot of hats in medicine. I have a small private practice, and as of yesterday, I'm also a teaching resident at the university. Um, Sonoran University, and I also supervise students who see our folks at the free clinic, which serves LGBT folks who are undocumented and asylum seeking. So I do a lot of gender affirming care as well. Yeah, so I just want to like orient us. This is one of my favorite quotes. When we try to pick out anything by itself, we find it hitched to everything else in the universe. And I hope two things, if you take away two things from this presentation, I hope you'll take away this first thing, which is that we as naturopaths view mental health as part of the whole person and really tied with when we pull out one thing, when we pull out someone's mental health symptoms, we find that it's connected to what's happening in their relationships at home, what's happening in their physical health, what's happening in their workplace, what's happening. So I think, sort of conventional medicine does folks a disservice when they say, oh, you just have these mental health symptoms, and that's the only thing that I'm going to focus on in this visit. Whereas we have to ask about everything else to really treat the whole person. Um, so, yeah. Here's where we're going. I have a brief history of naturopathic medicine just so you can answer folks' questions if they ask. How we practice, physical causes, um, common mental health treatments by modality, good referrals. And then if we have time, I have one sample case study so you can just see how our brains sort of process through things. Yeah. Okay, so naturopathic medicine is a distinct sect of medicine. That combines the wisdom of natures with the rigors of modern science. We're trained as primary care providers, which is great. We can diagnose, treat, manage acute and chronic. So if you've got an ear infection, if you've got diabetes, if you've got hypertension, I can see all of it. The difference here, though, is that we think about it in terms of body, mind, and spirit. So I'm just as concerned as what's happening with your thyroid as I am what's happening with your brain, as I am what's happening, in your spiritual life. And we really combine all of those together to look at the whole person. And then the other really important part here is that it's individualized. I could have two patients with the exact same disease conditions who have slightly different lives, and they might have completely different treatment plans. Because we want to make sure that medicine works for the individual, not the individual working for the medicine. So yeah. It wouldn't be medicine if there wasn't a little bit of corruption, unfortunately. So naturopathic medicine has been around since the 16 and 1700s, codified in North America in the 1900s. And then this is a really key part. So Abraham Flexner was a Johns Hopkins trained scientist. He was largely skeptical of anything nonconformist. And he saw the basis of disease as purely biological, as in like no social or psychological factors ever played into someone's condition. And so he was commissioned by Andrew Carnegie, the Steel Carnegies, to write this paper about the state of medical education in America. And as a result, no surprise, he wrote the report to basically discredit alternative approaches. And then Carnegie and Rockefeller's funneled tons of money into allopathic medicine and it became the gold standard. But before that point, naturopathic medicine was what everyone practiced when they went to go see their providers. And in case you're not familiar, allopathic medicine is drugs, radiation, surgery. It's what like conventional medicine or Western medicine is typically called. All right, so we undergo pretty similar training as MDs and DOs. We have 4 years of undergrad, we have 4 years of med school. The first 2 years are exactly almost identical. So we have, physiology, biochem, anatomy, all of that stuff. And then the last 2 years, we learn all of the allopathic modalities plus the naturopathic modalities. So homeopathy, a ton of nutrition, botanical medicine, IV therapy, hydrotherapy, all of those things. Again, trained in acute and chronic care. We have 2 licensing exams. We're accredited. And then this is really important. Not every state in America has licensure. So there are 26 states that have licensure, and each state has its own scope. Arizona, fortunately, is one of the best scopes in the country. So, in addition to, writing pharmaceuticals and labs and imaging, we can also do acupuncture and minor surgery and a whole bunch of other things. So, it's if you're going to practice naturopathic medicine, do it in Arizona. What's important to know about that? Oh, and I also put some questions on the bottom of some of these slides. If you want to ask your patients some of these questions, obviously practice within your scope. I don't know the therapist scope, but just some things to think about. There's this tricky thing where you want your patients to know that there are naturopathic doctors and then there are naturopaths. Naturopaths are unlicensed and typically go through like online schooling in these like degree mill type places. And if someone says that they're board certified naturopath, that's not a naturopathic doctor. Those are two separate things. And so if you ask your clients like, is your provider licensed? Make sure that they're in a state that has licensure, first of all. Second of all, is the person licensed in that state? Because otherwise, we don't know the training of those people. And, um, you know, even if they have gone through naturopathic medical school, they're basically acting as a glorified health coach. So they can't hold the full scope. So just, if you have any questions, ask your patients along those lines. Okay, so we practice sort of two big frameworks. We have the 6 principles of naturopathic medicine, similar, do no harm, healing power of nature. We're always going to keep looking back to how nature does things. Identify and treat the causes. So we're really looking for the root cause, right? If you're experiencing anxiety, that is a symptom. That might not be the root cause. Oh, shoot. Uh, so we're going to keep digging. What is the thing that is causing that anxiety to be expressed? Yeah. And then physician as teacher, I'm sure lots of you are aware, but the sort of baseline health education in this country is not great. So we're constantly educating our patients about, their disease processes, or I often get a lot of like, I saw this thing on TikTok. What do you think? Love those questions. So answering a lot of questions, and then also, really showing people the wide spectrum of their options when we're treating. So really educating about all of the options, treating the whole person, right? People's identities are obviously in the exam room. And so, making sure that we're seeing everything that's going on with folks, and then prevention. And then the therapeutic order, we start ideally with the determinants of health foundation. So good water, movement, good inlets and outlets, community, family support, quality food, movement, things along those lines. And ideally, we would move up the pyramid, but it's not always the case. Folks are pretty sick. And so sometimes they come in and we have to do some symptom relief in order to be able to get to the place where we can do the foundations and really get that going for them. Okay, so when folks come and see a naturopath, we will, in most cases, start by looking at mental health concerns from a physical perspective first. So, and that's really important, particularly if the patient has a new onset of symptoms, if the symptoms are out of proportion with the life or past circumstances. So, if someone has like what looks like on the outside a very stable, healthy life, and their PHQ-9 is 25 or something, you're like, what's going on here? That definitely deserves a physical cause evaluation. And then if someone's seeking a definitive diagnosis, so if they want to be diagnosed for ADHD or OCD, things along those lines, it's really important because some of those things have mimickers. So ADHD can sometimes show up, or ADHD-like symptoms can sometimes show up because of iron deficiency. So we want to, make sure that we're really looking at everything. And here on the right, I have, a list of things that can show up as mental health concerns. And just for some clarity here, I would say the bread and butter of most naturopaths is like anxiety, depression, ADHD. And so, these are some things that we're looking for before we move on to like the other social and spiritual perspectives of folks' mental health concerns. Okay, so this is how it goes. Unlike conventional medicine, which the average appointment right now for follow-ups is 15 minutes, most naturopaths will see folks for 90 minutes for the first visit and then 45 to 60 minutes for follow-ups. Our history is so extensive. I usually just let them talk for the first 30 minutes, like tell me your story, tell me what's going on. And then I say, I'm sorry, you might be a little overwhelmed, but I have a lot of questions. And we go through all of these things on the right, really looking for, again, going back to those foundations, like what are the things that are out of balance there, and seeing if those are things that are contributing to their overall condition. Some things that I want to highlight here are, I ask about diet. Yes, because of the actual nutrition content, but also I'm trying to figure out what is this person's relationship to their food, and food security. I've started asking, in the past couple of months, every patient, do you have enough food at home? Because the economic conditions, we don't know folks' financial situations, and I've just started asking really explicitly about it. And then menstrual cycle, I think, is particularly important because we know that different parts of the menstrual cycle might have different mental health ways that they present. So there might be more anxiety, more depressive type symptoms. And then if that's really out of balance, then that's one of our clues of things that we can go back to and say, okay, is this contributing to your mental health symptoms? And I think it's important too to be like, how particularly with a menstrual cycle, how is that contributing to your overall quality of life? Like if someone has a lot of pain, that's not going to be helpful. And then, something that's really different from naturopathic medicine to conventional medicine is we specifically ask, what are your health goals? Where do you want to be in 6 months, a year, 5 years from now? Because what I might think is the priority is not necessarily their priority. And so seeing if we can blend those things together. Of course, we do mental health screeners, and then we usually start with LabCorp or Quest Labs because most folks' insurances will pay for that. Obviously, they have to check with their insurance, but and when I say that, it's pretty extensive. It's not, a regular conventional med doc might be like, oh, we're gonna have a CBC, a CMP, a TSH, and a lipid panel and an iron panel if you're lucky. I have like 22 things in my first initial screening blood work. So the first set of labs is pretty extensive. Then we have imaging if we need it here in Arizona, and then specialty labs, which is important to know because those are not typically covered by insurance and they give us a ton of data. So specialty labs might be like food allergy testing, a stool test, hormone labs, cortisol, things along those lines, your extensive urine testing. And then if we need referrals and specialists, obviously we're going to get that on board. But this all happens in the first 1 to 2 visits. So that's where we're going first. And then we talk about treatment planning. So Again, going back to the foundations, always looking for the good foundations of health, the hydration, the whole foods diet, good sleep, regular activity, inlets, outlets, and community. But again, sometimes we can't start with that foundational work because people are just too sick or their symptoms are too much. And so we have to start with sort of some of the higher intervention stuff. Um, Again, every plan is individualized. And, I come to my patients and I say, this is my best plan A. Let's talk about it. If it doesn't work for you, then we got to like go back to the drawing board because the best plan is useless if there are barriers to the implementation. And so I'm really, really trying to meet patients where they are. So, speaking of treatment, I'm going to talk through the 5 most commonly used treatment modalities, and then talk about the rest briefly. Okay, so supplements. I feel like this is the most common thing you will see. And I want to give a little bit of background here. Supplements are not FDA regulated. And unfortunately, a lot of the supplements on the market are not third-party tested. They're fraudulent. They were made in unsafe conditions. They contain adulterants, like medications. Here, this is a health fraud database, and you will see, you can search this yourself, and I linked it at the end. But these supplements have, this is Viagra. So have casual Viagra and Cialis in their supplements. And so folks think that they're taking one thing and they're getting something else. Okay, well, then I'm thinking, where are you getting your supplements from? Is that contributing to your mental health concerns, right? Because maybe they're getting supplements that you don't know, if they're ordering them off of TikTok or Amazon is the number one offender, unfortunately. 50% of supplements are fraudulent on Amazon. And I've seen firsthand evidence of this being true. The font is a little bit different, or, they peel back the label and it's a different label underneath, or there's another different supplement in the bottle that has been swapped. And so, this is the other big thing. If you take away nothing from this presentation, ask your clients, where are you getting your supplements from? And so if they're not coming from any of these places here, you can ask them about. Here are some reputable brands. Again, I have no affiliation. I starred Pure Encapsulations because they're owned by Nestle, and some people have some moral objections to that. Here are some common mental health supplements. Unlike homeopathy, which we'll talk about in a second, a lot of supplements and herbs have interactions, which is important if someone is on mental health meds, say, they're taking an SSRI and they get a random supplement off of TikTok. Well, they don't know that could have an interaction. They don't know, what's in that supplement, and that combination can be not great. So let me just run through some of these. L-theanine is great for our folks who are anxious. Really slows that anxiety down. Omegas are great. Most mental health conditions respond well to omegas. Vitamin D, folks are pretty deficient. Even those of us that are living in Arizona have, so we can test this and then we'll give them the correct dose. Iron, again, I talked about with ADHD, and probiotics, right? A lot of folks with mental health concerns have gut issues. And so if we can fix the gut, then sometimes we can turn the dial down on mental health stuff. Adaptogens, working on their cortisol management. And then lots of other herbs on the market, combos or by themselves. So that is supplements. Okay, homeopathy. This is my absolute favorite modality. I use it very frequently. So homeopathy is an energetic medicine, and it uses ultra diluted substances to stimulate the body to heal itself. They come in little pellets, like this little blue thing, and there's little pellets in this bottle. You can also find the bottles are different colors based on the potency. So that would be the number here. It works by like cures like. So let me just give you an example. If you were cutting onions and you experienced the like watery eyes that you would normally experience with cutting onions, but instead you were just like in your regular life and you weren't actually cutting onions, then I could give you the remedy that is called allium cepa, and it is it's similar to onions, and it would make that crying situation better. So we need to match the remedy to the patient's symptoms exactly. There are hundreds of remedies, um, and these are some common mental health ones. I'm just giving you some of these examples. So when we talk later about working together, you can know like this is the level of detail I'm looking for. So arsenicum is a very common mental health remedy that we give to folks. And these are the folks that will like come into your office and they're gonna like fix the painting on the wall that's like a little bit crooked. They're like anxious about their health. They're like really restless. They might be like tapping their foot the entire visit. Um, you know, Ignatia is a big grief remedy. Sepia, this is your like postpartum mom who is like, I love my kids, but I just can't feel it. And is in the corner eating pickles. So these are not all of them by any stretch of the imagination, but these are some uh, homeopathic remedies. And it's important to know that they're not going to help certain conditions, right? It's not going to help cancer. It's not going to help a bone break or organ failure. And these single remedies, so these single bottles are most common, but there are combo formulas that are very effective. Um, and then I just wanted to give you a little bit of information here with homeopathy, in case your patient is, on homeopathy. Four things can happen, and we explain this to patients all the time, but they can take the remedy, they can get better, and they can stay better. That's pretty common. The second thing that can happen is they feel worse and then they'll get better. The third thing, they feel worse and they stay worse. It's incredibly rare. I've never seen it. And then the fourth thing is that I've chosen the wrong remedy and nothing happens. In which case we go back to the drawing board. But if you're working with someone who is on a homeopathic remedy and you like notice a shift, you can ask them like, did you change your remedy or did you increase your potency or like when's the last time you checked in about this? Um, yeah, so that's homeopathy. Okay. And diet and lifestyle recommendations. I realize this is probably very overwhelming, but um, our food that we are consuming now is not the same as it was a decade ago. The soil health is really poor, and we have pesticides and glyphosates and whatnot. And then, sort of taking a step back, I would say that most folks are really disconnected from where their food comes from, right? Like we don't know our farmers anymore. We didn't go down to the local store to pick it up. We like went to a grocery store, which is what it is, right? And um, but like recognizing that and recognizing the impact that that has on how people are interacting with their environment. Um, and rarely, I want to like be very clear about this, rarely are we recommending diet changes for weight loss purposes. I couldn't tell you the last time I recommended that. It's usually for inflammation modulation, gut healing, stable blood sugar, nutrient density, lowering the dial on the way that the neuroinflammation is playing out. Um, and typically we like try to think about it as like what can we add to someone's diet versus what can we take away. So can we add more whole foods or organic where possible or raised eggs? Like can we add more things into their diet instead of just being like, okay, well you need to go low sugar and gluten-free and dairy-free tomorrow. Then it just like doesn't usually work. And likewise, food is never just about the nutrients. It's also the mindfulness aspect. It's also about the connection aspect. Um, you know, are you eating all of your food on the 101 at rush hour? Or are you sitting down at your table and having like a beautiful meal with your family? Really getting people to slow down and be connected and tune in so that they can keep going on with their lives. Of course, I would love for folks to have less sugar. I think it's very effective. More organic, more grass-fed. And, we can't be so precise all of the time. People have constraints, people have financial constraints or time constraints. And so that again goes back to like the individualization of like, I have two patients with the same condition, and one has a budget restraint on their um, food budget and the other one doesn't. My recommendations might be tailored to that. Um, yeah. And then, no lonely carbs is something that I recommend often. People eat a lot of carbs by themselves. So, pairing that with a protein or a fat can be really helpful for blood sugar regulation. Um, okay. Exercise. The most common thing that I see is folks doing the wrong type of exercise for their situation. A lot of folks with burnout, I find, keep doing too much HIIT. We all need to chill on the HIIT. More Pilates, more yoga, more gentle walking. Um, Likewise, some folks are overdoing it and some folks are underdoing it, right? So here are the typical CDC recommendations. It's what I start with, and then again, tailor it to folks' needs. And again, trying to get people to tune into what kind of movement works for them, feels good, doesn't feel like, oh my God, I have to get every single ounce of willpower I ever had to go do this thing. Trying to switch the mindset from, oh, this is exercise to this is movement to make me feel good, to make, me be able to do the things that I want to do in my life. Um, and then some other lifestyle recommendations that we commonly recommend: meditation, MBSR. I'm not sure if you folks are familiar with MBSR, but I love it. It's mindfulness-based stress reduction. It's from John Kabat-Zinn in his book, Full Catastrophe Living. It's an 8-week course, and sometimes insurance pays for it. And so it's really great for folks with chronic pain or just like anxious bunnies who need to turn down the dial. Grounding, nature exposure, similar to our food, we're really disconnected from nature. I would say more so living here in Arizona because it's like sunny all of the time and we don't have a lot of seasons. Uh, and so getting folks out into the morning sunlight, trying to adjust their sleep schedule by the sun's schedule, which is very tricky, but can sometimes be really helpful. And then likewise, living in accordance to how someone's menstrual cycle works can be helpful in terms of energy management. So doing the annoying or creative tasks in the first half of the cycle and then doing like low energy or no meetings in the second half of the cycle is something that I often recommend. Uh, Obviously, I'm referring to you guys all the time. We need you on board with everything we do. And then the last thing here is sort of underrated and definitely lower on my list of priorities in terms of working with folks, but obviously on the radar is thinking about someone's products that they're using. So if someone has, you know, a menstrual cycle irregularity and then we find out it's because of their estrogen, then looking at what products are they using. So looking for conventional products versus sort of more natural products. And there's a website called EWG where you can search products. Um, yeah. Okay. And then we in Arizona can prescribe medication. We cannot do certain medications. So we can get DEAs, but they're low-level DEAs. And so we cannot do antipsychotics or ADHD meds or biologics and chemo. Not every ND has a DEA. So if you're looking to refer to someone and you want, something like testosterone, ask the person if they have a DEA. We have a tendency to utilize compounding pharmacies, which is great because then if someone can't swallow pills, for example, we can get them that medication in a different form or at a lower, more individualized dose. GLP-1s are in flux. It's because of malpractice restrictions. So check again. And then in general, our goal is to have folks on the lowest dose for the shortest period of time. But I'm not going to like take someone off of a really life-saving medication because I would prefer that they be on a lower dose for a shorter period of time. There are some things that folks need to be on lifelong, and we're going to keep going down that path. So some common prescriptions that we write, obviously SSRIs. LDN is low-dose naltrexone. You might recognize it from when they treat addiction. It's commonly in the form of Vivitrol. But at a lower dose, they've found to have autoimmune properties. And so we use it a lot with those folks. Obviously, hormones for menopause or gender affirming care, thyroid, cholesterol, diabetes, the whole rigmarole there. And then something that I think is overlooked on frequently is some medications can cause vitamin deficiencies. And if someone has been on a medication for a long time and they've not been supplementing for that deficiency, then that can cause mental health concerns. And so that is something that we look at along with all of the prescribing. Okay, and here are just some other modalities that we use: acupuncture, minor surgery. There are some folks that do aesthetics, and some folks may have a body dysmorphia that would be helped by some Botox or something. NDs can do stuff like that. I don't do it, but other folks do. Okay, good referrals. So we love folks who are looking for a natural first and individualized approach for concerns. Likewise, if they want a second opinion, if they want alternative treatment ideas, or if they're dealing with side effects from conventional treatment, we can work with those folks. I would love to see it more. I don't. But if someone was like, I want to optimize my health and I would just want to do all of the prevention things, dream patient. Preconception, fertility optimization, supplement review. If they're like, I'm taking these 20 supplements, what do you think about them? Great, awesome, would love to see them. They don't need controlled substances. They can be on them if others are prescribing them, but we don't generally do that. Willing to do the work, right? Our first few appointments are going to be 1 to 2 or every 2 to 6 weeks for an hour for the first few months, and then we spread it out. And then if folks are looking for a specific modality, making sure that naturopath provides those services. And then we don't treat cancer, but we can work adjunctively, and no childbirth or OB care unless they have an additional naturopathic midwifery certification. Going back to one of those questions from earlier, absolute no's, broken bones, physical or mental health emergencies. And then in Arizona specifically, we can't touch anything on the face or the ear that we suspect is cancer-like or requires a surgical procedure. So just some things to know there. Okay, collaboration, my favorite part. We absolutely want to work with you. We love working with other providers. We want to hear your insights. We want to know what you know or noticed from your patients. And if we're sharing a patient, please have them sign a release form so we can chat. Likewise, we also need your support. Sometimes when we make big changes, particularly diet and exercise changes, it's really tricky for patients. Even if they're like, yes, I can do this, they still need to talk through it one more time. And so having you on board to be that person to talk through it with is super helpful. We love to share resources. If you need a book, an article, support group, please don't hesitate to reach out. And then we can't provide medical advice to non-patients, but if you have a general question, like, I don't know, what medication do they use to treat hypothyroidism? I'm happy to answer it. So that is what we're looking for there. Okay, so here's my case study, just so you can see how we think through things. So this is an absolute fake patient. We have a 32-year-old woman with a history of depression and poor concentration, times 6 months. She has a stable job, partnership, housing, some family of origin stuff, but otherwise life is fine. So here right away, I'm thinking, okay, this is out of proportion with the circumstances. She eats a standard American diet. She has 3 coffees a day. She walks her dogs, but no other exercise. Sleep is fine. It's always fine. History of frequent childhood ear infections and adolescent acne treated with antibiotics. So there I'm thinking, okay, is her gut Is there something going on with her gut? Bloating, abdominal pain, constipation, and hair loss. Again, common uh, gut symptoms. Also, hair loss, potentially thinking about thyroid. Um, so here's how we're gonna go. We're gonna do the full history in PE. I'm gonna run all of my labs on her. And then here I'm thinking, okay, she probably has a gut issue going on. So I'm gonna do a specialty stool test. Turns out in this sample, she has SIBO. So SIBO is small intestinal bacterial overgrowth, very common. Um, and we'll treat the SIBO. SIBO can be a sort of longer treatment um, course, 3 to 6 months. Something for you to know when you're working with folks is that we say typically that for every year that a patient has been sick, it will be a minimum of 1 month for them to feel better, to begin to feel better. So really managing expectations with folks is key. And then throughout the course of our time working together, I'm going to work to try to decrease her caffeine and increase her water. We're going to have individualized supplements, morning sunlight, strength building, more non-family support, community engagement. I've been pushing hard for folks to get out into the community to sign up with a ceramics class or a walking club or do some volunteer work. And then obviously they're going to continue therapy with you. So this is just so you can see my thinking behind all of this. Yeah. Okay, and then these are some resources for you. I would not recommend you give these to patients. They're more provider oriented. So Whole Again is a great book that just is about homeopathy and has some really cool stories. Someone asked about menopause. Menopause Brain is my #1 menopause book right now. And I would even say it was the best book I read the entire last year. Talks about how the brain changes in menopause. Fast Like a Girl is a great book about fasting and timing fasting to the menstrual cycle. Healthy Kids is about gut health in kids and how it impacts everything. Change Your Diet. Georgia is a metabolic psychiatrist out of Harvard, and this book is about how diet impacts brain health. Good Energy, she's a little controversial right now, but I think it's a great overview on just sort of how we think naturopathically and functional medicine works. And then LDN, this is a great book. I happen to know that they have it in the library and goes through each condition that it can be used for. And then some podcasts. These particular episodes I think are really helpful. And then if you want to search the health fraud database, if you want to have a little Friday afternoon activity and see all the things that people have found in their fraudulent supplements, that's that. Okay, and yes, here's all my contact information and then the requirements for working together. And then if you have a patient who has to meet all 3 criteria, if they're LGBT, they immigrated from another country, and they do not have insurance, please reach out and I'll connect them with the free clinic. That is all.
That was amazing. Thank you so much for sharing all of that. As you were sharing, I was like, it would be an absolute dream if every one of my clients were working with a naturopathic doctor and could get like that thorough of an assessment of where they're at and just, whole picture of health. Um, yeah, that's really amazing. Well, I'm curious to the audience here if you have any lingering questions or follow-up questions on anything that was presented. Now's a good time to share that.
That was great. Some more like comment and then maybe a question. So I like love that. I'm like a person who wants the information for sure. So it didn't feel too overwhelming.
Yeah.
Um, yeah, and another comment I was just thinking, I've had like a lot of clients who are maybe struggling with sleep who want to go just to their, PCP because they'll prescribe them medication
Mm.
versus, it being more of like diet or right, maybe their circadian rhythm or something else going on. So I like appreciate that. I was curious, I guess this is like kind of going into another realm.
Okay.
So maybe we don't have enough time to talk about it. But how because you mentioned like diabetes, right? And treating that right
Mhm.
now, right? There's culturally like a big blow up in GLP-1s.
Yes.
Since I work with a lot of disordered eating or eating disorder clients, they're kind of like, well, I am pre-diabetic, or
Mhm.
like, I'm on that verge, and so this is going to help me. And
Mhm.
I don't have a lot of like medical understanding.
Mhm.
But I know like diet, movement, all of that's helpful because I do
Yeah.
a lot of intuitive eating. And I was curious just from your own perspective, like how would you maybe treat someone who's like pre-diabetic?
Mm.
Are there I'm going to say this wrong, home remedies
Yeah.
um, with that
Yeah.
you've noticed? Because I get that side, and then I get the other side of people experiencing like PCOS or infertility, and then also thinking that's like a need to like change my whole diet, and then they like lose a bunch of weight, and then I feel like that's impacting their hormones,
Yeah.
and it's like a whole thing, and I'm like just curious on both of those sides if you have like thoughts or
Yeah. 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 I haven't felt the need to use GLP-1s at all. I have been plenty effective without considering. I mean, honestly, it don't even cross my mind because we have so many tools. We have obviously diet tools, and it's yes about the actual diet, but it's also about the timing of food and really considering that in, you know, the whole realm of things. Also taking into account, okay, is this person a third shift worker? That's a huge contributor. Um, and then exercise likewise, and then we have a ton of supplements for um, that can help manage the blood sugar. And then on the other side, PCOS is obviously a metabolic condition, impacts hormones, and so diet and lifestyle have to be a part of that. And then it's also managing hormones as well. It's PCOS can be tricky. It can be really tricky. I think, and the other part of that as a therapist is managing expectations. It's going to take a lot of work. It takes some of these things take work, and you have to be committed to it, and that's hard for folks. Like keeping that motivation up can be really hard. um yeah, I mean, I don't want to go all the way down into the specific supplements and all of the things because it's a whole rabbit hole, but yeah, that's my
yeah,
overhead
that's
view.
helpful.
Yeah.
Hi. Sorry, I
Hello.
jumped on late today. I was eating while you were talking, which was probably awesome to watch. Sorry. But I appreciated what you shared so much. We definitely we have an integrative approach here. And so a lot of the things that you're talking about are just so important. I love what you shared and what you were doing. And it made me think about as therapists for us, it's so similar to like we're always trying to talk with our clients about like the symptoms, the things that are happening up here, right, are letting us know what's going on down here. And it's so similar with what you're talking about is we're trying to help them get to the root cause. And so I think that's such an important approach, the things that you were sharing. And that whole like referral to rather than just going straight to medication, like looking at like when was the last time you had your blood work done, what's going on in all of these other ways, like where are those tweaks that we can make, where we're listening to the body, we're not just trying to medicate the symptoms.
Right,
And
right.
so yeah, so
Yeah.
powerful, so I really
And they're
appreciate
clues.
it.
Symptoms are clues. Like we have to keep reminding folks of that. It's not,
Yeah,
it's not a moral thing. It's not, your body's not failing
you
you.
haven't
It's a
failed. Yeah,
clue to what's going on. And can we follow that clue until we figure out what's going on?
yeah, your
Yeah.
body is talking to you. Yeah, yeah, so
Thank you.
anyway, thanks, I appreciated what you shared.
I have a question. I know you mentioned not being able to provide ADHD medication,
Yes.
but I'm wondering, like, if somebody wants to not go the medication route and they want to more naturally treat
Yeah.
ADHD symptoms,
Yeah.
like, what did you say? You said that it could be something with their gut showing up like
Iron.
ADHD. Is that
Iron.
iron?
Iron
Okay,
is a
yeah,
big
that's
one.
so
Yeah.
interesting to me.
Yeah.
I hadn't heard that before. And so I suppose maybe that could be a good place to start. But then are there other supplements that you would
Also we
recommend?
need to consider with ADHD, it's not very common, but it still needs to be on our list is lead poisoning.
Huh.
Yeah, those are the two big ones that we rule out for ADHD symptoms. And then, of course, I'm looking at thyroid. You know, you just never know. Yeah.
Interesting. Okay. Yeah. Loved everything you shared. Thank you. Right. I love that. I think even just holding the question that a symptom as it's showing up might not be the full picture is just a really lovely awareness to hold as we're working with clients. And then working in tandem with providers like yourself,
Yeah.
investigating those things. So, alrighty. Thank you so much for sharing your time
Thank
and
you,
your
everyone.
expertise. Yeah, lovely to have you. Want to make sure folks get off to their next session if you have one at 1, but thanks so much for joining. All right, bye.